This week we'll go over the immune system and how the immune system works to protect us from various kinds of infections. By the end of this section, by the end of all of these videos, I hope that you will be able to identify important components of the immune system, describe in very general terms, remember this is not an immunology class, how the immune system helps to fight infection, and finally to understand how this concept called herd immunity works. When we talk about our immune system, we can almost think of it like an army that's trying to fight for us. And so to use that type of army terminology, we have our first line of defense. With our immune system, our first line of defense is sometimes also called our innate immune system. This is the immune system that we are all born with, and it is not specific. And what I mean by that is it will fight every type of infection exactly the same way. A little bit later, we'll talk about a part of our immune system that fights differently. So our innate immune system fights pretty much everything the same way, and it includes in our first line of defense all of the features that are illustrated on this cartoon person. And we'll go ahead and we can start right here, top left, and we'll go clockwise and briefly address all of these. In our upper respiratory tract, so your nose, sinuses, your mouth, and then your pharynx or your throat, you have a lot of mucus there. But you have air that's moving really, really quickly. So you have these cells in these areas that have what are called cilia. They're little like finger projections, and they'll capture whatever you inhale and throw it back out when you breathe out. So that's one really great way to protect these areas up here. Just how fast you breathe can prevent a lot of pathogens from being able to bind. Moving to the top right, Lysozyme in tears and other secretions. So tears, saliva, other bodily secretions have an enzyme. It's a type of protein. And what it does is it breaks down the cell wall of bacteria. So here they pointed out on your eyes, your tears. So if bacteria land on your eyes, that enzyme should break them down and prevent you from getting an eye infection. If microbes happen to get maybe a little bit deeper into your body, into your throat, into your windpipe, your trachea, you have a lot of mucus in there, and hopefully the microbes will get stuck. And then those finger-like projections, those cilia on some of your cells, will help move that mucus out of your body. You also have mucus deeper in your lungs, and you have cells that are called phagocytes. So phagocytes are cells that you make that eat microorganisms. They engulf them, and that process is called phagocytosis. That can help microbes from establishing infection in your lungs. You also have proteins within your blood and your lymphatic system, like your lymph nodes, that prevent microbes from growing. As we go down, what they're trying to point out here is this junction between the stomach and the small intestine. There's a pretty significant pH change. It actually jumps from pretty low to a little bit higher. So it's pretty acidic in your stomach and it gets less acidic in your intestines. That change in pH is hard for microbes to adjust to. Within all of your intestines, you have bacteria that live on and in you. And those microbes help protect from bad microbes or pathogens from binding. So just having the good microbes can help keep the bad ones out. In your urinary tract, you urinate, and that movement of urine, that flushing, can help prevent microbes from causing a urinary tract infection. Here they're showing in the small and large intestine, you have normal bacteria that prevent colonization. In your stomach, You have a very low pH. It's very acidic. And most microbes can't live in that acidic environment. So a lot of them get destroyed. And the last thing we'll talk about, your largest organ is your skin. And that physically protects the inside of your body from infection. So as long as you have intact skin, you don't have any cuts or wounds, it's hard for microbes to get in. So not only can the microbes not do well getting through your skin also has fatty acids that make your skin just a little bit acidic, and a lot of microbes don't like that. But there are some microbes that do. So you have normal microbes that live on your skin, and just like in your gut, they help the bad microbes from being able to attach. So these are some of your first line of defense to protect you against infection. And I think it's important for you to think about, like, all of these things your body has. If you don't have one of them, or if one of them is compromised, that's when you can start to get infection. So your body does a lot to try to protect you, just because of the way your body is. If we zoom in a little bit more and look at the skin is got a few different layers. So the outer layer, if we're looking at a cross section of the skin, it's like they took a section of skin and we're looking through it. So this part at the top would be outside of the skin. This part down at the bottom would be going deeper into your body. So the outer layer of the skin is called the epidermis. At the very, very top part, this is the layers of the epidermis with some keratin. A lot of this is basically what will be like your dry skin that will slough off. So if you have a little bit of peeling or whatever, that's what that is. But basically everywhere you go, you shed skin cells. And this is what you're shedding. I don't mean to gross you out, or maybe I do because this is killer microbes, but a lot of the dust you have in your house is actually like your own shed skin cells. If you go a little bit deeper into the epidermis, you have more of the living cells that aren't so dry. And then when you start to get through the epidermis, you have this layer called the dermis. And here's where you have a lot of connective tissue like collagen and things like that. But so that it will eventually move out, and the layers will progress. But as long as all this is intact, you're pretty good. And a lot of this dryness also helps a lot of microbes from being able to attach and adhere. To go a little bit deeper into your mucous membrane, these are layers of tissue that line your gastrointestinal tract. So your all the way from your mouth to the anus, like the whole gastrointestinal tract, your respiratory system, your nose, your trachea or your windpipe, and your lungs, and genital urinary tracts. In males, those are the same. In females, there's a urethra and a vagina, so they're different, but they all have kind of a mucus layer. And mucus, it's snot, right? You know what that's like. It's gooey, it's kind of sticky. It's made of proteins and sugars. That's glycoproteins. So they're proteins attached to sugars. Those will trap microbes. It's hard for microbes to get through that mucus, and it also prevents those areas from drying out. Specifically within the lungs, you have those cells. I told you have these little projections like fingers called cilia. And what they do is they're kind of there underneath the mucus layer. And let's say something gets trapped. Those cilia, those fingers, they all kind of beat in the same direction. And so if you picture them in your lungs, they're trying to move mucus up away from your lungs, and they want to drop it down your esophagus so that you'll swallow it and it'll be digested. That helps you destroy anything that could have gotten in the mucus in your lungs. And the cells that they're highlighting here, these goblet cells are the cells that actually produce the mucus. And so we call that, in the respiratory tract, we call that the ciliary escalator, because just like an escalator, the cilia are all moving in one direction up from the lungs, and they try to drop the mucus down your throat. Some of your other areas of defense, earwax. It's sticky to help prevent microbes from entering the ear, but it also helps to keep your ear from drying out. And you have hairs in your nose that can help to trap microbes as well. Other physical factors, I'm sure you've never seen it because you can't really see that far down your throat. But as you get a little bit farther down your throat, the tube you have splits. So to a certain point, food and air go down the same tube. But as you're eating, you have a little structure called the epiglottis, and that, as you eat, basically closes off the tube, the trachea that goes down to your lungs. So it prevents you from inhaling food. Sometimes you can still inhale food, and that's pretty bad. You don't want to do that. But most of the time you don't. And food is contaminated with microbes. It's got your saliva all over it, your oral microbes. So you don't want that to get into your lungs. So the epiglottis opens up when you're breathing to let air in, but closes when you're eating to keep food and stuff out of your lungs. You also have processes in your body that work to remove microbes. So peristalsis are the involuntary muscle contractions that move contents through your digestive tract. So you don't know it's happening, you don't really feel it, but it's happening all the time. If it stopped happening, you would feel it. Defecation removes microbes from your body. And if something has gotten in there, like a toxin or a microbe that your body is like, no, vomiting and diarrhea can result. Those all will physically remove microbes from the body. You also have cleansing action. We talked a little bit about tears, how they have that lysozyme, but they also will just physically wash things away. Even if they don't destroy the microbes, they're physically washing microbes, dust, anything that's gotten in your eye, it washes them out. Other cleansing fluids include saliva, helps to clean your teeth, get any microbes that shouldn't be there, hopefully get them out. Urine, vaginal secretions, semen, nasal mucus, all of those things can cleanse the area where they're found. They should flow out of the body and remove microbes to prevent colonization. So saliva, you're like, I don't have saliva, falling out of my body. Well, it goes down your throat, right? And it goes into your stomach where it would be digested. So it all will remove microbes and prevent colonization. The final part of the first line of defense are some of the chemical factors that our body produces to protect us. For example, we produce a kind of an oily compound called sebum. It's a fatty acid, especially found in like perspiration. So any areas of your body that are moist, and it should help to destroy fungi that might try to establish an infection. So things like athlete's foot or jock itch are caused by a fungus. So it forms a protective film and it lowers the pH. That acid can also help inhibit bacterial growth. We've already talked about Lysozyme that can destroy the cell wall of bacteria. And Lysozyme is found in your sweat, your tears, your saliva, your urine, and any other fluids around the tissues. And we produce chemicals that have a low pH that are acids. We make our own acids. So stomach acid is anywhere from a pH of 1.2 to 3. That's pretty acidic. It destroys most microbes. Vaginal secretions also have a low pH, between 3 and 5, so not nearly as acidic as the stomach, but still pretty acidic, and that inhibits microbes as well. You may remember, if you've taken chemistry classes before, the pH scale is by factors of 10. So if something is pH 2 and something else is pH 1, the thing that's pH 1 is 10 times more acidic So not just like 1 time more acidic, it's 10 times more acidic. So gastric secretions can be anywhere from 10 to 100 times more acidic than vaginal secretions. So that's what we're talking about, that scale of pH.